Hello my good people, welcome back to my YouTube channel whereby we always give you educational bangers each and every day. And before I continue or before I start any of my videos, I always appreciate you people for pushing this channel forward since we started. It's all because of you that I'm making these videos. It's all because of you that this channel is where it is at the moment, and I always appreciate because you are part of my family and you are pushing this channel to greater heights. Let's continue sharing, liking, and encouraging our brothers and sisters to support this channel so that it may grow bigger and bigger and to greater heights. And if you subscribe, always remember to put the notification bell on so that if I upload any video, YouTube will automatically notify you. We are still talking about lipomas or skin lumps, and today we will start by seeing the treatment modalities available for lipomas, or how can you treat a lipoma. Typically, a lipoma will not cause any adverse health problems. That's why some people can stay with lipomas for years. So typically, a lipoma will not cause any adverse health problems. However, dermatologists can treat the lump if it bothers you. It can be treated if it bothers you or for cosmetic purposes. Many people don't like seeing such lumps in their hands or wherever in their body. So you may decide to get it treated for cosmetic purposes. They will make a treatment recommendation based on a variety of factors. The dermatologist will make a treatment recommendation based on a variety of factors, including the following. These are the factors which the dermatologist will consider in giving you a treatment recommendation. Number one, size of the lipoma. Size of the lipoma. Number two, number of skin tumors you have. Number of skin tumors or lumps you have. Number three, whether the lipoma is painful or not. Whether the lipoma is painful or not. These are the three main factors that a dermatologist will consider before giving a treatment recommendation. Number one, size of the lipoma. Number two, number of skin tumors you have. And number three, whether the lipoma is painful or not. Let's start discussing these treatment modalities, and we will start by steroid injections. Steroid injections, and as we know, steroids can be used as anti-inflammatory. So when you give a steroid, your aim is to reduce the size of the lipoma. So in steroid injections may also be used direct on the affected area. So the steroid can be used directly on the affected area. This treatment can shrink the lipoma, but it does not completely remove it. Steroids shrink the lipoma or reduce its size, but cannot completely remove it. Let's talk about diagnosis, or how will you diagnose a lipoma. Healthcare professionals can diagnose a lipoma by performing a physical examination. Healthcare professionals can diagnose a lipoma by performing a physical examination. In some cases, your dermatologist might take a biopsy of the lipoma. Biopsy means cutting part of the lymphoma or the skin lump, taking it to the laboratory for analysis, maybe if it may be cancerous or not. So, in some cases, your dermatologist might take a biopsy of the lymphoma. During this procedure, they take a small sample of tissue and send it to a lab for testing. Or in biopsy, a small tissue or a small sample of tissue is taken and sent to the lab for testing. Medical professionals carry out these tests to rule out the possibility of cancer, as I have said before. Medical professionals carry out these tests to rule out the possibility of cancer. Although a lipoma is not cancerous, it can rarely mimic a liposarcoma, which is malignant or cancerous. Although a lipoma is non-cancerous, it can rarely mimic a liposarcoma, which is malignant or which is cancerous. So that means lipoma is non-cancerous. A liposarcoma is cancerous or malignant. Further testing using an MRI and CT scans may be required if a biopsy shows that a suspected lipoma is a liposarcoma. Let me repeat this again, and it's very important. Further testing using an MRI or magnetic resonance imaging and CT scans may be required if a biopsy shows that a suspected lipoma is liposarcoma, or if a biopsy shows that the suspected lipoma is cancerous. That's when you go ahead and carry the MRI and the CT scans to confirm before you put the client on chemotherapy. Lipomas may vary in shape and size. That means they are in different sizes and shapes. Lipomas on different body parts may also appear different. Lipomas on different body parts may also appear different. Let's talk about the removal of lipomas. The first treatment was the steroid injections, and now let's talk about the removal. And I think by the end of this chapter, I will attach some videos which will be showing the procedure, how we always do it, or how we remove these skin lumps or the lipomas. The most common way to treat a lipoma is to remove it through surgery. This is always a minor surgery. So the most common way to treat a lipoma is to remove it through surgery. This is especially helpful if you have a large skin tumor that's still growing. This is especially helpful if you have a large skin tumor that is still growing. Your doctor will typically carry out an excision procedure with you under local anesthesia. Your doctor will typically carry out an excision procedure with you under local anesthesia. Local anesthesia means you just numb the area you are operating on, not the whole body. They will make an incision in your skin to remove the lipoma and sew up the incision site after removal. They will make an incision in your skin to remove the lipoma and sew up or stitch the incision site after removal. I think when I attach the video by the end of this topic, you'll be able to see how it's always removed. because I have some videos. I was conducting this procedure to a client. So thank you for your time. Thank you for supporting this channel, and let's continue subscribing, liking, and sharing our videos so that we will be recommended all over in the world. Have a wonderful day.